Good morning. I would like to extend a warm welcome to all of you on behalf of eHealth magazine. My presentation will focus a bit on the eHealth scenario in India and how eHealth has become a platform to disseminate information to all our readers about eHealth technology. To begin with, I would like to start with some of the current healthcare scenario, some pointers that are there. Probably all of us know about these, but it's worthwhile to discuss these on a platform like this. If we talk about the Indian public health system, in the WHO member countries, there are around 191 countries, and India ranks 118th, which is still, it's a daunting figure because out of 191, we are, not even in the first 100. And if we talk about the past decade, the average public expenditure on healthcare has been around 0.35% of the GDP, which is pretty little as compared to other countries like the USA. If we talk about the hospital beds in the rural area, there are only around 0.2 beds per 100 population. So we can all imagine the lack of healthcare services in rural India. Also, there are around 20% of hospital beds in the rural areas, and our population in the rural areas is about 70%. A villager on an average has to travel 2 kilometers to avail healthcare services, 6 kilometers for a blood test, and 20 kilometers for hospital care. Impediments for healthcare. All of us know these. The vast geographical spread of the country, billion plus population. There's a complex mix of diseases, conditions in India with the 3 gold medals that we have, being the diabetes capital, being the cardiovascular diseases capital. Talking about acute shortage, there's an acute shortage of medical and paramedical manpower. There's a lack of proper healthcare infrastructure, uneven distribution of medical and healthcare resources. In addition, there are poor socio-economic conditions and traditional belief systems among rural communities. Benefits of e-health. Many of us know that there is around simultaneous multi-location provisioning of medical care through use of technology. E-health overcomes barriers of physical distance and shortage of qualified doctors by providing basic care, better capacity to manage and respond to emergency conditions, and efficient utilization of financial, material, and human resources through better information management, intelligence, and effective decision making. Components of e-health. E-health can be disseminated through telephone, through internet, or through mobile. The systems and solutions, I've enlisted some of the systems and solutions which are the components of e-health: health IT and automation software, EMR, EHR, healthcare management information systems. There are communication equipments and there are medical equipments. If we talk about the current status of e-health in India, there have been various initiatives taken by agencies all across the country. If we talk about ISRO, we talk about Ministry of Communications and IT, Ministry of Health and Family Welfare, and there are a lot of private institutions also that are doing a lot of work in this area. These are a few number of hospitals that are providing telemedicine services, and about 250,000 patients are treated through telemedicine centers in India. Government initiatives, again, Ministry of Communications and IT, these are the various programs that these organizations offer for providing e-health services in India. If we talk about academic hospital initiatives, there is AIIMS, there is PGIMER, STPGIMS, Tata Memorial Hospital, PGIMS, and Chhatrapati Shahuji Maharaj Medical University, Lucknow. These are, of course, a few of the hospitals. Apart from these, there are many others that offer e-health services in India. Corporate hospitals, everybody knows about Apollo's initiatives. Sir Gangaram Hospital is doing a lot of work in this area. There is AIIMS, Narayana Hridayalaya, Shankar Netralaya, Sri Ramachandran Medical College, and Arvind Eye Hospital. Research organization initiatives. There's CDAC, Media Lab Asia, Biraju Foundation. All of these are doing tremendous work in e-health in India. If we talk about the national health information infrastructure and standardization, there's a defined framework for IT infrastructure for health, prepared guidelines and standards for practice of telemedicine in India, national broadband policy by Telecom Regulatory Authority of India, dedicated satellite for e-health by ISRO, that is the HealthSat, revision of medical curriculum in process, National Telemedicine Task Force, Ministry of Health, Family Welfare, Government of India. Challenges for e-health. There's unavailability of sufficient bandwidth across all parts of the country. Though the ministry is doing a lot of work in providing good broadband services across the country, but still I would say there's a lack of bandwidth. There's lack of technical capability and IT skills in rural health centers, hospitals, and clinics. Low level of confidence among general public for technology, aided remote diagnosis and consultation. There's lack of financial resources, 0.35% of GDP being invested for healthcare. Absence of e-health policy. We'll come to some facts and figures. About 57% of patients do not get a doctor appointment when actually required. 12% people avoid visiting a medical center due to distance factor. And 12% of people do not get access to a doctor even on a phone. Forget about the rural areas. We are covering the entire country. In rural areas, the condition is even worse. 46% would go to a primary care center. 16% would go to a specialist, 20% would go to urgent care, 7% would go for an emergency, 11% just don't go anywhere. So that is the lack of healthcare services provided in our country. This is an IT at Hospital survey, which is a biannual survey of that eHealth magazine covers in a gap of 2 years. This we did in 2008, and again we'll be doing it in 2010. These are some of the figures that the survey had to offer in 2008. I would like to bring to your notice, this slide shows the driving forces for hospital automation in India, mission trust hospitals versus private hospitals. And I would say, if we see growth of health insurance, nil in both these sectors. So this is something that, we'll have to work upon. Advantages of IT implementation in hospitals. Long-term strategic planning, almost 91.30% of people said that this is the biggest advantage of IT implementation in hospitals. This slide depicts the systems and solutions used in different categories of hospitals. Again, there's a mix of mission trust NGOs, private hospitals, 150 plus bed hospitals, and 300 plus bed hospitals. Types of software usage. Around 73.9% people say that they use customized solutions, while there's commercially available off-the-shelf software and hosted solutions, which 13%, 21.7% of the people use respectively. Paperless hospitals, still a long way to go. Only 14% hospitals in India are paperless. 86% still maintain paper records. Medicines can be shipped anywhere, but not doctors. I would like to bring to your notice this slide, which is my last slide of the presentation, that the requirement of e-health is so huge, and e-health magazine, it offers applications of e-health, technology of e-health, and how e-health can change our lives. Thanks a lot.